Leonard Hale and Mia Lacsamana walked the same hospital halls, but only one of them knew their secret would end in murder. St. Elwin Medical Center operated like a city within a city, filled with constant movement, alarms, and rushing footsteps. Every morning began with a familiar rhythm, stretchers rolling through glass doors, nurses exchanging updates, and doctors preparing for another demanding day. The hospital's tall white building stood as a symbol of trust for the people of Chicago. Inside, the polished floors, steady beeping monitors, and bright lights created an atmosphere that made patients believe they were in capable hands. Among the staff was Dr. Leonard Hale, a surgeon admired for his calm confidence. He walked through the halls with a quiet authority that made others step aside without question. His colleagues described him as disciplined and flawless, someone who handled pressure better than anyone else. Patients saw him as a hero who always knew what to do. Because of this reputation, nobody imagined the darkness he carried behind his composed expression. Working in the same environment was Mia Lacsamana, a hard-working Filipina nurse who blended effortlessly into the fast hospital pace. She was known for her warm approach with patients, her careful attention to detail, and her steady presence even during the busiest shifts. Many trusted her more than the doctors, believing she understood their pain more gently. The hospital brought Leonard and Mia into the same spaces again and again. Their daily routines overlapped in operating rooms, medication stations, and quiet break areas. To everyone around them, these were just ordinary workplace interactions. Yet hidden within these everyday moments was the beginning of a connection that would eventually unravel everything the hospital believed it stood for. Dr. Leonard Hale's life looked perfect from the outside. He lived in a quiet Chicago suburb with his wife and young daughter, presenting an image of stability and discipline. Neighbors often saw him leaving home in polished shoes and a pressed white coat, carrying the confidence of a man who had everything under control. But behind this image was a man who craved admiration and control far more than he admitted, even to himself. He relied on the respect he received at the hospital to fill the emptiness he kept hidden at home. Inside St. Elwin Medical Center, Hale operated with a different set of rules. Away from his family, he let small boundaries blur. It began with brief conversations, small favors, and unspoken attention toward Mia Lacsamana. What seemed like casual workplace interactions slowly turned into a private bond. Mia, new to the city and far from her family in the Philippines, appreciated any kindness shown to her. She believed Hale's guidance came from professional concern and experience. She never imagined he was slowly creating emotional dependence. As time passed, Hale became more invested in Mia's life than she realized. He lingered in places where she worked, noticed details about her routines, and studied her expressions during stressful shifts. The hidden nature of their connection made it easy for him to rationalize his actions, convincing himself it was harmless. But Mia eventually sensed a shift. His compliments became more personal, his presence more frequent, and his interest harder to explain. What began as a workplace relationship was quietly transforming into something dangerous, shaped by Hale's growing desire to control what he feared losing. Mia's life changed the moment she learned she was pregnant. The news arrived quietly, in a small clinic room after a long shift, but its impact was immediate and overwhelming. She felt fear at first, then a rush of determination. She had built her life from scratch since leaving the Philippines, working long hours to support herself and send money home. The pregnancy was unexpected, but she saw it as a chance to create the stability she had always dreamed of. She imagined raising her child with the same strength her own mother had shown her. When she told Leonard Hale, everything shifted. His reaction was far from what she hoped for. Instead of concern for her well-being, she saw panic flash across his controlled expression. He viewed the pregnancy not as a new life, but as a threat to the perfect image he guarded so carefully. His marriage, reputation, and status felt suddenly fragile, as if one wrong move could shatter everything. Mia, however, refused to let fear dictate her choices. She made it clear, to herself more than anyone, that she would keep the baby. She started researching prenatal care, planning a budget, and imagining ways to adjust her schedule. The thought of raising a child alone scared her, but her resolve brought her a surprising sense of peace. Hale's pressure began almost immediately. He tried to influence her decisions through subtle warnings, emotional manipulation, and reminders of how complicated things could become. But Mia's decision didn't waver. What she saw as a new beginning, Hale saw as a disaster. That contrast set the stage for the dangerous path he would soon take, driven by fear of losing everything he believed he deserved. Hale's anxiety grew heavier with each passing day, turning into an obsession he could no longer hide from himself. The pregnancy became the center of his thoughts, overshadowing his surgical precision and calm public image. At work, he monitored Mia more closely than ever, memorizing her shift patterns and volunteering for assignments that placed him near her wing. His need to control the situation intensified until it shaped nearly every decision he made inside the hospital. Mia noticed the growing tension in small but alarming ways. Hale appeared in hallways he normally never used, showed up during her breaks, and lingered near her workspace under the excuse of checking patient charts. She felt a quiet pressure hanging in the air each time he approached. His presence became a weight she carried throughout her shifts, but she tried to focus on her work, hoping his behavior would eventually fade. Instead, Hale's desperation escalated. He began to manipulate the staff schedule, using his senior position to move Mia between units under the pretense of coverage needs. He wanted to limit her interactions with others, believing that keeping her isolated would give him more control over her decisions. Staff members noticed her growing discomfort, but assumed it was the stress of long hours and difficult patients, never thinking a respected surgeon could be the cause. In private, Hale convinced himself he was acting out of necessity. He believed that if he didn't intervene, everything he had built, his marriage, his career, his image, would collapse. This self-justification fed the darker thoughts he tried to suppress. He no longer sought a solution, he sought an escape. And in his mind, the only escape was removing the problem entirely, no matter the cost. The storm that evening rolled over Chicago with a low growl, shaking the windows of St. Elwin Medical Center. Staff hurried through the halls as the lights flickered under the pressure of the weather. Most departments were short-staffed due to the unexpected power issues and the growing wave of emergency calls. The hospital felt different, darker, quieter, and more vulnerable than usual. It was the kind of night when people focused on surviving the shift rather than noticing small details around them. Mia had agreed to stay late to finish patient reports and assist with paperwork left behind by the earlier rush. She sat at a desk in a dim corner of the surgical wing, sorting through charts illuminated by the soft glow of emergency backup lights. The silence around her felt unnerving but necessary. She wanted to finish quickly and go home to rest. She didn't notice how empty the hallway had become or how far the nearest staff member was. Hale had been waiting for a moment like this. Throughout the day, he had tracked Mia's movements with increasing agitation. The storm created perfect conditions. Fewer people on the floor, distracted staff, and just enough chaos to cover any unusual activity. When he saw she remained after her shift ended, he watched from a distance until he was certain she was alone. The surgical wing was familiar territory to him, filled with rooms accessible only to those with special clearance. He moved through the dim corridors with practiced ease, confident no one would question his presence. Every footstep echoed in the quiet, merging with the distant hum of unstable power lines. The darkness, the silence, and the isolation worked together to form a setting he believed he could control completely. Mia continued working, unaware that the storm outside wasn't the only danger closing in on her. Hale approached the restricted surgical area with the confidence of someone who belonged there. His ID badge granted him access to rooms most staff rarely entered. The dim emergency lights cast long shadows across the tiled floor, giving the space an eerie stillness. He paused for a moment, listening to be sure no one was nearby. The storm outside masked distant sounds, and the usual steady rhythm of the hospital had slowed to an unnatural quiet. Mia was finishing her final report when she felt a sudden shift in the atmosphere, a sense that someone else was in the room. Before she could gather her things, Hale stepped inside, blocking the only exit. His expression was cold, stripped of the careful charm he normally displayed. His focus was fixed entirely on her, fueled by fear and desperation. Mia stood, instinctively trying to move toward the hallway, but Hale's presence made it clear she wouldn't get far. What happened next unfolded with shocking speed. Hale's panic overpowered any sense of reason, and the confrontation escalated into violence. The small room, meant for preparing surgical instruments, became the site of a tragedy no one had imagined. With the hospital nearly silent and most staff occupied with storm-related emergencies, no one heard the struggle. Within minutes, Mia's life was taken from her inside the very place where she had devoted herself to saving others. Hale worked quickly to stage the scene, relying on his medical knowledge to craft a false explanation. He altered logs, moved equipment, and arranged the room to resemble a sudden medical collapse. By the time he left, he had convinced himself the plan would hold. The following morning, he walked into the hospital as if nothing had happened, believing the chaos of the storm would hide the truth he had created. The investigation began routinely, following hospital protocol after any unexpected death on site. At first, staff accepted the explanation that Mia had suffered a sudden medical emergency. She had worked long hours, often skipped breaks, and faced constant stress, factors that made the claim seem believable. But small details in the report raised quiet concern among the administrative team. The timeline didn't match her last known tasks, and her digital chart entries stopped abruptly in a way that didn't follow her usual habits. Security footage became the first crack in Hale's carefully constructed story. Investigators noticed he had entered the restricted area minutes before Mia's final activity was logged, despite having no scheduled procedures or responsibilities in that section at the time. His movements appeared deliberate, as if he knew exactly where he was going. Even more suspicious was the fact that he lingered in the hallway far longer than necessary. As investigators dug deeper, inconsistencies multiplied. Hale had accessed patient logs linked to Mia's department on the night of the incident, though he had no patients there. The digital audit trail revealed he attempted to alter several entries shortly before the power fluctuations. His explanations were vague and unconvincing, lacking the clarity expected from a seasoned surgeon. Emails recovered from Mia's account revealed a private correspondence between them, subtle hints of a relationship she had tried to distance herself from. Staff members recalled the nervousness she displayed in the days leading up to her death, though they hadn't understood its cause. Each detail built upon the last, forming a picture investigators could no longer ignore. The respected surgeon who once stood untouchable began to appear increasingly trapped. His polished image faded as the evidence aligned, pointing to a truth far darker than anyone at St. Elwin had imagined. Hale's arrest happened in the most public way possible, right in the middle of the hospital lobby. Morning light poured through the tall glass windows as police officers stepped inside, their presence immediately drawing attention. Staff members paused mid-conversation, confused at first, until they saw Hale being approached and handcuffed. The shock rippled through the building like a sudden chill. The man many looked up to, the surgeon known for calm leadership, now stood silent and cornered, unable to escape the evidence closing in around him. Once in court, Hale's carefully built identity unraveled with each hearing. Prosecutors presented the digital audit trail, the suspicious footage, and the personal emails that exposed the hidden relationship. Colleagues testified about his unusual behavior in the days before Mia's death, and experts noted how precisely the staged scene had been crafted, knowledge only someone with Hale's experience could execute. His attempts to maintain composure faltered as the narrative shifted from respected doctor to desperate man trying to protect his own image. The trial revealed the extent of his manipulation and the fear Mia had carried in silence. Her story spread through the media, capturing public attention and igniting discussions about workplace safety, power imbalances, and the vulnerability of hospital staff working long, isolated hours. Her determination to keep her unborn child became a symbol of courage, and community groups honored her memory through vigils and advocacy efforts. Hale received a life sentence, his reputation destroyed and his future sealed behind prison walls. The hospital implemented new safety protocols and support systems, determined never to overlook warning signs again. Mia's name lived on in memorial plaques and scholarships, reminding everyone that her strength endured even in her absence. In the end, the truth caught up with Hale, and the life he tried so desperately to protect crumbled under the